Hello, everybody. My name is Mark Horowitz. I'm a psychiatric trainee and researcher, and I helped to co-found Outro, and I feed into the clinical protocols we use at Outro. All of my research is about how to safely stop antidepressants and other psychiatric drugs. And I've come to that area of research because I had a lot of trouble coming off antidepressants and other psychiatric drugs. We are very pleased to have the one and only Angie Peacock here to join us today. So people who can't make it, this is going to be uploaded to our YouTube channel, and we'll send out a reminder to everybody via email so you can watch it again if you miss anything. We were sent in a lot of great questions, many of which we will try to cover today, some of which we've covered in previous webinars. And we also are going to point out a couple of things that are coming up. If there's any therapists in the audience, we'll have another webinar coming up with a therapist called Megan in October. We've already covered a lot of hyperbolic tapering on specific antidepressants. So a lot of those videos are uploaded to our YouTube channel. If there are any antidepressants that people want to hear more about that we haven't covered, put a little comment under a YouTube video about which drug you want to cover, and we can cover that. And we also have another interview coming up with Adam Urato, who is a obstetrician and gynecologist who works in Boston, who is an expert in the effect of antidepressants on pregnancy, which I think is a topic of very great interest. There was an FDA panel about that, and he's a very knowledgeable expert. So I'm looking forward to interviewing him on September 22nd in a couple of weeks. But let's turn to Angie. Angie, do you want to introduce yourself so that the audience, anyone who doesn't know you, which I'm sure is not many people, know who you are?
Sure. My name is Angie. I was a military veteran who deployed to Iraq and was diagnosed with post-traumatic stress, and then put on various antidepressants, antipsychotics, benzodiazepines, and all told, it took 13 years before I kind of figured out that the medicine was kind of making me worse. So I successfully tapered Cymbalta for 2.5 years off 20 milligrams, and then I was left on a benzo and endured a very harsh cold turkey withdrawal from my doctor. During my healing process, a film crew found me, and Medicating Normal came out of that recovery process. And for a few years, I toured with the film, showing it all over the world on Zoom and in person. And then after that, when I was about 6 years off, I quit and started coaching full time. I do have a master's in social work, and I trained as a traditional trauma therapist, but declined licensure so that I could coach people that were deprescribing and who were injured by the system in some way. So now I coach full time, and I do peer support groups for Outro. And I just love the importance of peer support. I don't think you can do it without it. So that's kind of what I'm here to talk about today.
So yes, I should point that out. So Outro patients have a peer support group run by Angie at 11 a.m. ET on Fridays. People tell me it's one of the highlights of being a part of Outro. I've gone along to listen in. And she also does her own coaching. You can find, she's got a website, Angie Peacock Consulting, if you want to check that out. Is that the right website?
Or angiepeacock.com. Yeah.
angiepeacock.com, sorry.
Yeah. That's okay.
So I had so many things I wanted to ask Angie. I've tried to arrange it so I get through most of it. And then if there's any time at the end, I know that Angie has to go on the hour. I'll ask any questions from the audience, but we might not have time. So put in a very high quality question in the comments if you want to get it asked. So I wanted to kind of go through the journey from people thinking about maybe coming off their drugs, and what happens afterwards, and ask a few questions about each stage that mostly the audience has put before this talk. So number one, so whatever you think about people you've seen, your own experience, I guess this is a question that comes up a lot, and there's all sorts of ways of answering it. How do you know when you're ready to begin tapering?
That is a great question, because most people that I talk to say it's never a good time. But I do think there's some preparation that needs to take place. So for instance, a person should not be wishy-washy about, I'm not sure if it's the medicine, maybe I am mentally ill. Like, you do want to do some processing around that, because if you go into it and you start experiencing symptoms of withdrawal and then you get confused about, is this my mental illness? Is this some new condition? Do I need to go back on medicine? That's kind of like a little bit of a danger spot. Like, you kind of want to be sure that this is right for me. I've done enough research. I've talked to enough people. And perhaps you talk to your doctor, you talk to a coach, you talk to a therapist, you talk with yourself. Like, am I really ready to endure? Because there's probably going to be symptoms. Am I prepared for that financially, emotionally, spiritually, at least to some extent? I don't think you should go in blind and just willy-nilly try to reduce your drugs without it being a well thought out process.
Okay. Yep. I think it makes sense. So in other words, you've got to understand something about withdrawal effects, what the process looks like, what relapse means, if that's relevant to you, what
Hmm.
were the source of your mental health problems. So maybe you could talk through for the average patient, what sort of issues do you think they should weigh up when making the decision to do so or not? What are the sort of issues that come up for people?
So I think just as a lot of us are upset that we didn't get informed consent for going on psychotropics, we should have informed consent for coming off. So it's not that you want to think about the worst case scenario, but you should know that people can endure some pretty intense suffering. They lose the ability to work. They could lose the ability to do activities of daily living, like taking a shower. And it's a hard road. And Mark, you probably think about this too. Even lately, I've been thinking like, this is not a good decision for some people. Like maybe some should stay. You know, you think about your age group. If you're in your 80s and you risk a fall that could end your life, that's not a good idea. You know, so like I think there's some cases where you it's not a good idea for everyone. You know, if you really want to get an A+ in the situation, I think nutrition should be looked at. You should have a therapist in place to talk to or some kind of program. Your family needs to be on board, your social system. You need to have good support. That's like the best case scenario. But
Yeah. Yeah.
it's not a decision to be weighed lightly, I don't think.
I agree. I mean, I guess for people who might be sitting in the audience and be frightened by hearing, won't be able to shower, won't be able to work, do you think there's a big difference between if you come off the drugs very quickly versus if you come off them very slowly? Because sometimes I guess you're probably seeing people that didn't plan the process, came off quickly with their doctors in a few weeks, and therefore had all these issues. Whereas I don't see that as often when we're looking at people coming off with Outro or in my clinic in London, because they have sort of learnt from that. Yeah.
Exactly. Like most people, okay, most people, if you catch it early enough, like you are not symptomatic, you look at your baseline. Outro is catching these people way earlier. Like I want to start and I haven't started yet, and I want to do that in an informed way. Okay. The way that the mainstream is doing in many cases, it's the wrong way, which leads to people having trouble. So there's different cohorts of these people. And even the patients that find themselves in a crash can get restabilized, usually, not always, but they can attempt again and it can be way smoother the next time. So don't take what I said as like it's everyone's experience. It's just something that you want to be aware of. Like I need to do this in an informed way with the proper support so that I can keep and maintain my quality of life throughout the process.
Yeah. So it's a good point, because I guess what as you say, there's different cohorts of people. And so one of the cohorts of people that Outro sees, some people are on their drugs, taking it stably, have thought about coming off, might have tried in the past and had a terrible time like you've talked about. So they've learned that withdrawal exists. And they are sort of sitting, sometimes they're in a fairly comfortable position or they're having some side effects. And those people are weighing up, should they come off or not? And I guess you're making the point that if you come off too quickly, sometimes what people do with their doctors or abruptly, it can be disastrous. And that's worth knowing. And some people have been through, unfortunately, some people only learn it by going through it.
The hard way. Yeah.
But I guess, yes, if you catch it before then, or if you're informed, you can sort of avoid the worst of the way of what happens to people that go off too quickly.
Exactly.
And so maybe we'll focus on those sort of people for a moment. Someone who is, let's say, I'll give you, it's probably easier to do with a scenario. A middle-aged woman who was put on an antidepressant 20 years ago after the birth of her first child, where she was very anxious, couldn't sleep. And now, she's in her 50s, her kid is at university, and she thinks, I think I'm a bit emotionally numbed. I've heard about this in the news. Maybe the drugs do this. My sex life with my husband, a bit gone down the toilet, maybe because we're older, maybe because of the drugs. I think my memory's a bit off. Maybe it's because I'm a bit older. Maybe it's the drugs. I did try to come off, 5 years ago. My doctor told me to halve it, stop it. I had panic attacks for 3 months, went back on it, maybe pretty scared, and now I'm thinking about coming off. What sort of things, should I do it? Shouldn't I do it? What sort of things might someone like that thinks? I don't know, maybe it's not who you see.
No, I've seen hundreds of women like that, actually, hundreds. I would say that's more the women that I do see. And it seems to be like some stage of life when the kids leave the house and menopause hits that they start rethinking like their health and what's the priority now. So I've seen a lot of women like that. So for me, it would be self-care practices are number one. Like, what can you do daily? that is calming to your nervous system, that helps you through the process, that supports your body while it's recovering, while it's adjusting to all the dose reductions. I would look at diet. I'm just more holistic. I think about the whole thing. Like if we want to be mentally healthy, it's not just reducing the drug. There's other things that go into that. So self-care practices, support, nature, like walking, being around people that love you, that helps so much, especially in this process. So to me, that's like bare minimum, in addition to like, okay, what do I really think about the medicine? What do I know about hyperbolic tapering? What is my taper plan? Who am I going to for support? I think those are like bare minimums for that cohort.
Okay. In other words, you're basically saying they should max out their sort of non-drug coping skills so that they feel
Yes.
that they've got kind of comfort from other places if things go a bit wobbly, or if they if they sort of to help buffer them through the system, through the process of coming off the drug.
Yeah, and I just think it's just, we need that in life. We all deal with stress. We all deal with troubles from family. There's lots of social media input, bad news. Like I would want people to think about their health. Like if you want to come off, it's kind of like a little bit of a healing process in a lot of different ways. I don't know. That's just the way I see it.
And I think sometimes people say, the things that they learn in the process of withdrawal, if they had known those things before they went on the drug, they probably wouldn't have needed
They
the
would
drug.
not have gone on the drug.
Yeah.
Yep.
So I think in some ways it's sort of making reparations sort of after the fact. Okay. And what is someone like, keeping with our hypothetical Mrs. X, what if she says, but I'm unsure whether I need this drug? I've been on this drug for 20 years. I was in a real bad way, 20 years ago, and the drug was helpful to me. I felt calmer. How do I know I'm ready to stop it now? Yes, actually, you know what? I have taken up, I do, I walk and I do yoga with friends, and I do feel like I'm a bit better than I was in my 30s. But how do I know that I'm well enough to come off? This is the pointy question. So I'll give you all the tough questions.
I like it. I like this question because, first of all, I never am here to coerce anyone that their medication is bad or that they should come off. That is not my job. I am not here to do that. I'm here to support people that have made that decision. So if that person wants to talk through it, this is why I love coaching, because instead of therapy, because if I can get the person just to hear themselves and they can talk and they talk it out, inevitably, they always say at the end, either, yes, I want to come off, or no, I don't think this is right for me. Not right now. I'll revisit it in 6 months. So I think if, I can ask some questions to the person, like some questions I might have would be, what do you think the medication has done for you the last 20 years? What are the pros of it? What are the cons of it? How do you feel in your body right now? Do you feel your emotion? How is your libido? Are those things that bother you? Because some people don't care. They're like, I don't really need a libido. I'm not interested in sex right now. I'm menopausal. It means nothing to me. Okay. Other people, it's a very important value to them. How do you feel? Do you feel your feelings? Are you able to cry? Does that bother you? And then let them decide for themselves. Again, I'm not here to tell anyone what to do with their medicine. I'm not. Usually the question I get the most is, if they start getting symptoms or even side effects while they're on the medication, they might say, okay, but what if I am mentally ill? And then if we follow that out a little bit, okay, well, if you are and you've tried the medication and the medication didn't really work or fix that problem, then what does that mean? And so people are kind of stuck there, because then they say, well, I did try 5 different antidepressants and I did try, outpatient therapy. And now I still wonder, does the medication what's keeping me from being my whole self that I want to experience? Is it that? Okay. And then follow that with another question. Okay, if it is that you are still bipolar or major depression, or you still have panic disorder, is there another way that you can heal instead because you tried the medication and it didn't work for you? And inevitably, usually people say, like, I just feel like I don't have a choice. Like, I have this doubt that this medication is, blunting me in some way, or it's injuring my libido, or I don't want the long-term risk profile, or I want to get pregnant. Like, I feel like I need to at least try. And so I just want to go slow and do that in an informed way. So that's usually the process people go through. You should think that out. Like, what do I think about my original diagnosis? For me, it was, yes, I had a reaction to trauma, but I should not have been medicated for that. And actually that derailed me from my healing process. And I did think it worked, but at a certain point it didn't. And so you can change your mind. You can think it works, and it did, and it was true for you. And then later you rethought that and you want to try something different.
Okay. So there are a few threads I want to pick up there. So I think you've given really clear overview of the themes. Some people are basically saying the side effects are really impairing to my life and I want to try life without it. Some people are saying maybe I've developed other techniques to manage things. Some people like you're saying something slightly different now. You're saying about yourself, you're basically saying this diagnosis that you were given, PTSD, that you were told you needed medications for, you've rethought and decided that not only was it not helpful to you, maybe it was unhelpful in some ways. Can you explain how you went from, I guess, being someone who believed you had PTSD and terrible mental illness to being someone today that sounds like you don't think you got terrible mental illness? How did that? That's probably it's quite a big question,
Yeah,
maybe.
no, it's just, it makes me think of Bob Whitaker, because whenever I present with him or we do a conference together, we always talk about narratives. And so it's almost like you're in one dimension of reality that believes in mental illness and that your symptoms are scary and that you should be afraid of them and you should report them and you need to medicate them and treat them. That's like one paradigm. But then when something happens to where you start questioning that narrative, like, okay, maybe these side effects are not my mental illness. It's actually coming from the medication or from the treatment, and the things that I'm believing about myself perhaps are not true, but I believed them for a while and I lived in that reality, and now I'm just believing something different about myself. And so I think I just went through that process. It was very slow. Like it took, a decade and a half basically for me to come to another conclusion.
Yes.
And then hindsight is 2020, because you start to see, wait a minute, like, maybe all that medication that I tried actually harmed me and did not let me heal and integrate my experiences. And now I have to do it now, later, I don't know. It's a narrative shift. At least it was for me.
I find it very interesting how people go from thinking, yes, I think exactly the way you framed it is right. You're in one sort of story, a narrative, and then you switch to another one. How do you get there? So, for example, I was very interested for a while, why do psychiatrists, some of them become critical and some don't? What is it? And I'm working with a research student. Why is it that some go along with everything's brain conditions? We all need medications, better medications. And some people think that makes no sense. And there are certain themes that I sense. So, for example, some people do degrees in ethics and anthropology. It makes them think about the whole thing, fits into a certain story. And I'm a bit jealous of those people because they're clever people who worked it out by reading books. But then there's a set of other psychiatrists where I only worked it out because the drugs really hurt me. And that made me rethink things. So I would say the main thing, because I feel the same way, I once thought of myself as someone with depression. I'm a highly dysfunctional person. Probably need medications, to not thinking that now. I'm just a regular dysfunctional person. And I guess for me, the journey was very much about withdrawal effects. Withdrawal effects really was the wake-up call that made me, because I was definitely in that narrative. I was doing a PhD. I was studying how the drugs work. I was telling patients about, their terrible illnesses. I was sort of completely part of the system. And I guess withdrawal effects made me pay attention. Oh my God, I almost died coming off these drugs. That's not part of this narrative that I'm telling people or myself at all. And that made me slowly, it took me two times to work it out. The first time I just thought, it's hard to come off these drugs. And the second time I read Joanna Moncrief and Robert Whitaker, I started to think this whole kind of, brain-based, illness-based narrative doesn't make sense. So it sort of fell to pieces in my hands. But the first thread was withdrawal effects. Why these drugs are so helpful, so hard to stop. If they're so hard to stop and we're proving that the drugs work by these studies where they're stopped and we assume people getting worse means they must need the drug, that doesn't make any sense. What is the effectiveness of the drugs? Hold on, what is the brain science of these conditions? It all sort of ended up...
We went down the science rabbit hole.
The door opened because I had such an awful time. That's what changed. That's what sort of changed my orientation. It sounds like probably a bit of a combination for you.
Yeah, I think what for me it was, there was this whisper. I remember like maybe 4 years into the medication when I started noticing sexual effects. And I'm in my 20s. I should have been dating. I should have been, pursuing relationships. And I just had no desire. It was like an ice cream scoop was removed. Anything sexual was removed from my brain. And I knew something's not right here, because I was married and had a very active sex life, and now I don't even think about it. Like something's wrong. But when I brought that up with practitioners, they would say, that's your post-traumatic stress, that's your trauma. And so I believed that for, a year or something. And then there was another whisper, like, why do I feel bad all the time? I don't ever feel gratitude or joy or happiness. Like, why not? Okay, so then there was like another question. And then basically the last few years, there was a couple of like very poignant experiences. One was a therapist that just gave me a quiz and said, okay, now you have generalized anxiety disorder. And I was like, this is like my 5th diagnosis. Like, why can't they get my diagnosis right? I don't understand this. Okay. Then the next one was going to a psych ward and being greeted by police officers. And I was like, I'm here voluntarily. Why are they treating me like this? So it was kind of like questioning plus withdrawal effects is kind of what my wake up was that made me shift a narrative. But you're making me think of one person I worked with, and this is really interesting. They had come off a benzo, they wanted to get pregnant, and they were still on an antidepressant. And so we had to make this decision. I had to help her think through it. Do I get pregnant on the antidepressant or do I taper off, but then I'm going to be close to 40 and then my risk for Down syndrome is higher? Like, how do I make this decision? And I remember her saying, like, Angie, I feel like I'm muted. And I said, some people, that's a side effect and they like that. They don't want to feel anything. And she said, well, maybe I liked that before, but like now I don't like that. Like I want to feel my kids and I want to be happy and laugh. And so that's an example of where somebody can have a side effect and they had it for years and they didn't notice or they didn't mind because life was stressful or whatever. But then it kind of switches and they're like, wait, I don't like this effect anymore. So I just think when I hear these statistics about like 1 in 5 people are on medications and only, people need them or something, or they work, it's like, okay, but for how long and for who? You can change your mind. We have a lifespan. It's not just like a concrete set of numbers and time, we can change our minds.
Absolutely. So I think you're covering so many pertinent themes. I still want to grab one of them. You're saying a few things that relates to one thing that I see all the time, which is people mistaking the side effects of a drug for a mental health condition. I think that's the trickiest thing. Because when I've got people that I see that say, I feel very emotionally flat. I don't get much enjoyment for things. And that's why I know I must stay on the drug. And what they're saying, underneath that is the idea, I must be quite depressed. Okay, the drugs maybe are not working as well as I'd like them to work. But if I wasn't on them, I'd feel even more of this. And I'm kind of, it depends. I always start from where someone is. I don't want to, frighten somebody or confront them too much. But I want them to know at least that a lot of people that take antidepressants, feel emotionally numbed. And as you've said, that can be helpful, especially in the short term, but it can contribute to a lack of sexuality, a lack of emotion. So I do see that all the time, that people confuse what are probably side effects. You can never, I think the other thing is you can never prove it. You can't say there's a blood test, 100% the emotional numbing is the drug. But I think on the kind of balance of probabilities, for a lot of people, that is the case. And so it is interesting how people become aware of that. Sometimes I show people a list of the side effects of a drug and they kind of go, oh my God, I've got this and this
All
and
that.
actually 10 of them. And I never thought it was the drug. So I do think that comes out a lot in people thinking through these things.
And for me, lastly, I'll just say it was anxiety. My anxiety was so bad. I was convinced I need these medicines because they're treating my anxiety. I did not realize it was actually rebound anxiety from the medication wearing off. And so my prescriber kept confusing that also and saying, you have agitated depression, you have generalized anxiety disorder, we need to put you on lithium. And then I just said, no, enough. Like, enough. I am on an anxiety medication and I'm more anxious than I've ever been. Something is not right here. Like, that's kind of how it came to a head.
Yes, that was definitely true of me. I've never been more anxious, more depressed, and more emotionally labile in my life than I was when I was on 5 psychiatric drugs. But when you're kind of in the whirl of it, you don't see it. You lose perspective because you're such a sort of mess. So I think that's the trickiest thing, when the drugs themselves in the long term can contribute to those sort of negative effects. It's very hard for people to untangle it when they're inside it. People see it from, in retrospect, it's very clear, but inside it's very hard to see.
And lastly, just for prescribers, you're seeing anxiety, and it maybe is not the DSM deficient definition of anxiety. It could be a side effect or an iatrogenic condition from the medication. It's very confusing.
Yeah, I agree. I mean, I sort of have sympathy for my colleagues because, if you're trained to sort of see mental illness getting worse, that's what you see. It's very hard to step back and see this could be because of medication. You have to do a lot of reading, a lot of thinking to kind of see, the bird's eye view. And that's sort of why I like, Joanna Moncrief's sort of thinking, where she compares these drugs, yes, to drugs, to recreational drugs, of course, lots of which make people feel better in the short term, and the long term do the opposite. I think that sort of paradigm makes it much easier to understand what is going on, why people often say the drugs help me, and I believe them, but also why in the long term, the opposite can happen. How can people explain their decision to their friends or family? That comes up a lot. Friends and family think you need the drug and you decide you haven't. What sort of things is it worth letting people around you know?
It's a hot topic because usually I recommend and I don't make any money from this. I'm just saying, go watch Medicating Normal. Let your family watch it and digest it. Because to me, it's like a crash course in withdrawal, and they can kind of get the main points and try to get it to them in a quick, succinct package with experts, that talk about it. Because usually if you are trying to push your family and send them videos and send them, Mark's papers, it pushes them away because they're like, okay, I get it. All right, your medicine hurt you. I don't know what to say about that. And I think it's confusing for loved ones because the person looks normal and sounds normal, but they don't feel normal. And so it's really hard for the average person to understand that. So what I see a lot is there's a few core people that will stay and understand and believe you, and then others will be pushed away or turned off by it or threatened by it because they might be on medications themselves. So I would just say I would not push everyone in your life to really get it because they probably can't unless they've been through it. It's tough. So I always just emphasize, try to find healing buddies. I think that's mandatory. Find someone in the community that you can relate to, that you can talk to. I know Mark's had healing buddies. I've had healing buddies. Hang on to those people because we believe you. You don't have to convince us. And just be careful with the people around you because it can push them away.
Yeah, that's a fair point. I agree. You can't convince everybody of everything. It's sort of like trying to, convince everyone to recycle or something. Some people won't do it, whatever you say, whatever you send them, whatever videos. Do hope, maybe I'm hoping, I don't know, that with more and more in the news, there's now NPR had a thing on antidepressant withdrawal, 2 different articles, and there was actually an article on withdrawal in the Psychiatric Journal in America last week. I wonder if there's slowly, I think still the average person doesn't know about it, of course, but maybe it's creeping up there where it's, when you send sort of a reputable source rather than pages on the internet, as useful as they are, I think that can be helpful. Yeah. But yeah, I agree.
Yeah, I agree. Print out a couple articles. Yep.
Okay, let's jump to now. People have decided to come off. They want to come off, and I'm going to put to you, what do you think is the best way to come off an antidepressant or other psychiatric drug after having seen thousands of people go through it? What works the best?
Slowly. I think Mark, me and you might not agree on this completely, but I have seen more people build success and confidence starting slow. Like, don't guess and jump to 10% because that's where you read all over the internet. It's 10%, 10%. And honestly, I think we leave out, like, look at your baseline. What's your starting point? Okay. Are you symptomatic? Are you not symptomatic? Did you catch it early enough? Start there. Okay. If you're really symptomatic and you're fragile and you're scared about the process, do not guess and lump off 25%. You don't want to do that. Go slower, like 2. Okay, I'm just going to try and just see. This is a test dose. How does my system handle 2%? It should be slow. I would say like your first month should be slower than 10, like way slower. Okay. And obviously I have a bias toward people that are more injured. I'm trying to prevent people from crashing in the first place. To me, it's just smarter to start slower and build your way up to a sweet spot rather than guessing and lumping off a big chunk because you don't know and you're unsure. It just builds confidence if you go slower and you do this in a really thoughtful process. Also, my biggest thing is listening to your body. Like, we should not be going by every first of the month, I'm going to cut 4% no matter how I feel. I think it's more like from month to month, I reevaluate, how do I feel? Was 4% too much? Do I need to back off to 2%? Do I need to wait a month? This is the opposite of what I think the system has taught us, where we just listen to the doctor and they tell us what to do and we do it. This is opposite. This is my taper. I go with the rhythm of my body, of what I can handle from month to month. And I'm listening into myself as much as I can, even when I feel like I can't hear it. So that's kind of the way I think about it.
Preach, sister. I don't disagree with a single word you just said. So I get told off all the time by everyone around me for going too slowly, because I agree with you. What is the point of going too quickly to get into trouble? I try not to alienate some of my clinical colleagues too much by being compromising, but I think exactly what you just said. Why, I think of it like driving a car. If you go too slowly, you can always speed up. People might beep you a bit, but there's basically no consequences. If you go too fast and you crash, you can't just press the brake then. It's too late. So I completely agree. Why not start very slow, see how it goes? The kind of complication of getting a liquid or making things, yes, it's a complication, but it's way less complicated than getting into withdrawal and having a terrible time. So I couldn't agree with you more. I also, even though I have spent years of my life printing out thousands of pages of what doses to follow each first day of the month, everywhere there's a sort of red flag that says, do not just follow this.
Do not do this. Yeah.
Do it at the rate that you can. This is just a way to frame things, mostly for doctors, so they have something concrete to hold on to. But I completely agree with you. The rate that you feel slower is better than quicker. You've got to balance the risk of being on the drug, but for most people, the risk of coming off too quickly is much greater. So I completely agree with what you said. So
And
I
I
really
always say just slow is fast, fast is slow. If you go too fast, it actually slows you down in the long run. So why even bring that upon yourself? Like you said, you can speed up from a slow. And I always show this. Let me show it real quick. But I use this as this is your nervous system, and your job is to keep it as stable as possible. Don't miss a dose. Don't go too fast, because once you get like this, it's kind of hard to get it back down. So the point of tapering is a little bit of a shake and then back off and wait till it kind of calms down again. Like that's our job, not to like crash. Or I had a term for it because I have a client that did this. I'm like, you are bulldozing your taper. This is not like hurry up and get off because it's hurting me. Because a lot of people say that, like, oh my God, I learned about these drugs. They're poison. I want off. But if you do it too fast, you're going to want to not be in this planet. So no, it's not like that.
Yes. So I quite like your why. I like the idea that the nervous system is a very fragile thing. You don't want to chuck it off a cliff, and if it goes wrong, bring it back up. You want to treat it very gently, like it's, fragile material. What is the biggest mistake or regret that you've seen people coming off their drugs? What's their biggest regret or biggest mistake they think they made?
There's a couple. One of the pitfalls is, I feel so bad, I got to do something. And that could look like TMS, stem cells, psilocybin, MDMA, ketamine, another antidepressant, a benzo. Usually, if you're trying to fix your symptoms, you're going too fast in the first place. Now, that's not to say if it's a life or death situation and it needs to save your life that you need to take something else. I understand. But I've seen people that as soon as they just get a little bit of suffering, it scares them. And then they either have to go on another drug, or they go back up, or they try something else. And that can cost them 6 months or 8 months or something like that. And that's the part I really struggle with, because I think this process can be easy for some and hard for others. And we really don't know what category you're going to fall in, But trying to find things to fix the symptoms, I think, is like the number one. I think some people don't think out the decision completely. Like, for instance, I got to sleep, so I'm going to go on mirtazapine because I need to sleep while I'm tapering Lexapro. Okay, that might work in the short term. However, let's think about magnesium, L-theanine, melatonin, like warm baths at night, some soothing activities, turning your phone off at 8 o'clock. There's other things to try besides medication. So I just think there's such a socialization toward, I got to do something else and it needs to be medication related, that people don't think out that decision all the way, because inevitably 6 months later they say, oh crap, I went on mirtazapine, that helped me, but like, now how do I get off of that? And now that's another 2.5-year taper for them. And it's just something that, either a coach or a clinician or a friend did not talk through with them, making that decision. So those are like the two things: trying to find a patch for some symptoms that you're experiencing that are actually withdrawal related, and then just not thinking out decisions that you do make.
Totally. And I think one thing what you're saying is, I totally agree with you. If you're using other drugs or you're looking for other things desperately, the main sign is you're going too quickly. And the analogy I use, probably people have heard, is, altitude sickness. You go up a mountain too quickly, your body can't handle it, you get altitude sickness. If you heard someone was going up a mountain and they kept going, but they started drinking whiskey to manage the symptoms, you'd be thinking, they're going to get into more and more trouble, because they're masking the symptoms maybe a little bit, but they're still doing the thing that's causing the altitude sickness. It'd be much cleverer to wait where you are, or go back down and then go more slowly, and sort of take the lesson from your body's wisdom, or what it's physiologically capable of doing. So I totally agree with you.
And I also like work with people when they get symptoms like sleep. I see somebody in the audience that is struggling with this right now, who's one of my people that I help. And we talk a lot about, like, if my body is not sleeping, my taper is slow enough, we check that first. Okay. But if my body's not sleeping, it doesn't mean I'm going to die or I'm going to go psychotic, or like, it means my body is trying to do some kind of repair process, and I need to stay out of the way and try to distract myself and not worry so much about my sleep, because the more I worry about it, the less I'm going to sleep. I call myself a healing coach, but a lot of the times I'm like, no, I'm a suffering coach. Sometimes I have to teach people how to be with the little suffering that they have, like tinnitus. Okay, there's nothing I can do to take your tinnitus away right now. How are you going to be in relationship to that without reacting to it and trying to fix it with another drug? Like, that's madness, So it really, to me, the only power that you have in withdrawal, and I say this all the time, is your reaction to what is happening. That's it. We might not be able to change your symptoms or speed up the process or shrink the amount of years that it takes to taper, but how you are in relationship to your suffering and your symptoms and your life is about the only power we have sometimes.
Yeah. I wonder, it's a very, you see people internationally. I think in America it's maybe worse than elsewhere. I think that everyone around the world has sort of been taught medicine has the answer to everything, and suffering, you don't really need to have it. But I do think that message is twice as loud in America, that I see, so many drugs given to so many different people for such small things. Started to think that after seeing everything I've seen with drugs in research and in practice in my own life, I think that there's no such thing as a free lunch, that any drug that makes you feel good in the short term, that makes you relaxed or calm or fall asleep, is going to cost you in the long term. I think everyone knows that if the drug is given to you in a nightclub, everyone knows that lesson, but they sort of don't understand that as clearly when it comes from a doctor for psychiatric conditions.
Yeah, true.
My other question is, you sort of touched on it lightly. How do people distinguish between relapse of their condition and withdrawal effects? Do you see sort of people kind of thinking through that?
Yeah, I touched on this earlier. Usually the struggle is, what if I am mentally ill? What if I do actually have bipolar? But I tried the medicine, it didn't work, so I got to try other things. There's tons of other things to try, okay? There are people successfully living off medications. It is not an end all be all for everyone. Even me, I still struggle with anxiety. It's true, okay? And guess what? I have a new relationship to my anxiety. I don't run and tell a therapist every time I have a panic attack. It's not something I do. If I need to panic, I sit there and I allow my feelings and I just roll with it. I had a little bit of a trauma response at Burning Man. A friend was there to hold me through it. I kind of worked on some of that while I was there. I see healing in a different way now. But usually the key is if you have physical symptoms, okay? So I have a lot of people that have mental symptoms. They have looping, they have OCD-like tendencies, they have like worries, what if, a lot of fear in their life. And they will also have like nerve pain or burning or head pressure. So often we kind of hang on that like community wisdom that if I still have physical symptoms that don't fit in a DSM-5 category, it's probably likely I'm still in withdrawal. So it's very hard for the brain to understand uncertainty. Like, I'm not sure about what's happening right now, and I need to not make a decision about how I feel right now. We all want this like certainty, like, is this a mental illness? Is this not? And I just think so many of us have been taught to be afraid of your mental health. That is not necessary. You don't have to be afraid of feeling big feelings about a situation or feeling depression. Maybe there's a purpose for it. Maybe there's a reason for it. I have a lot of people, this makes me so sad, that say, I'm on medication because I'm in a bad marriage. I was put on medication because I'm in a crappy job that I hate. And then when they start to come off, they're like, I can't do this anymore. I have to leave this marriage or I have to change this job. This is what's contributing to my mental health. So I would say, in short, it's okay to have feelings and symptoms and not be afraid of them or try to treat them or stop them or fix them or suppress them. That's part of being human. And part of my process and others, it's coming back to it's okay to feel all this stuff and not have a label for it and to be a little uncertain and not be sure about what is actually going on. And let me wait it out a little bit if I still have some physical things going on.
Right. Well said. I think, sorry, there's a few different directions to go, but one I wanted to grab onto is, and so you said it before, that you had sort of reframed what you had happened to you as not being mental illnesses, but I guess what you've been through in the Iraq War and so forth. I see a lot of people who walk away from their diagnoses in the process of coming off their drugs. I almost think it's sort of the last phase of deprescribing. I spend a lot of time talking about geeky things about hyperbolas, but I do think the people reframing their sense of self and what's happened to them is a very important part of things. Because ultimately, if you walk away thinking that you still have a mental illness, you're prone to use another medication the next time something goes wrong. So I almost feel like our job is not done in just getting you off a medication, because if the same mindset that leads you to take more medications is still there, then the problem is likely to recur. So I think when you talk about, you say, example, bad marriages and things, I often have people, the question I ask people the most is, what was happening when you started the medication? Did some brain condition just pop up in your head, or, and I can't think of anybody.
There's always a reason.
Always a reason. Exactly. People say, had a new child, moved countries, had a horrible job. My husband did this, so it's sort of like, when they hear that, I do think it starts to make more sense to people. I think a lot of people already just need a little push to think through, what was going on, rather than accepting this sort of chemical imbalance, mental illness, lifelong brain condition kind of story.
Yeah, I can only think of 3 people in the last 3.5 years that still identified with their mental illness label. I was shocked to realize that, like, when I started doing this work one-on-one, people had no use for that anymore. They're like, it doesn't help me. It doesn't make sense. Now I've rethought that. Maybe they did their research before they ever found me. I don't know, but I was surprised. Like, we never talked about that. It wasn't in the lexicon. And then last thing I want to say is that was one of the reasons why I did not work in the system, because when I did my internship hours, I worked with refugees, people with no access to healthcare, in a free clinic that was Spanish speaking. And every single person that I met, I was like, I can't even understand a reason to send this person to get medication. They have a reason, a very valid reason in their life why they are here, and they're trying to talk to me. And so I could never make that connection. People have reasons why they feel the way they do. It's not just something lands on you, the way that you said it, exactly how I think about it. Like, it didn't land on them. There was something that happened.
Yes. I think a lot of people would be helped much more by a social worker. If they've got financial problems, with financial advice, relationship problems, migration advice,
Coach, something.
coach, yeah, physical health, all these things that
But
explain.
further, I think that's one of the struggles with deprescribing going in the mainstream, is because it's not just coming off the meds. There's a whole lot of stuff that goes with that. That's one struggle I think the mainstream has. The second thing I want to say really quick is that when people are off the meds and they've come through it, I work with a lot of protracted people that are off meds for 2 or 3 or 4 or 5 years. And I notice that there's people that come back once they get out of that acute phase, they start getting their life back. They come to me and they say, Angie, I just need to tell somebody my story that believes me from start to finish. Like, this is what happened. And they are trying to like make meaning and make sense of it, because now they have that perspective of like, I was medicated since I was 13, and this is what was going on in my life. And now this happened, and now I'm here. And it's very emotional. Those sessions are super emotional. I cry with them usually, because it's like, that none of this needed to happen,
Yeah. Yeah.
And so they are still coping with like identity and making, who are they now? Who are they outside of the system? Who are they without medications? How do they handle life now? It's very moving and sad. I'm like choking up just thinking about it. But yeah, it's more than just coming off the meds. It just is.
So I totally agree. I guess I have been one of the people pushing deprescribing to the mainstream, and I know that it's hard to get through all the different messages that need to come with it. And I do feel that if the mission, if it ends up being that people come off their drugs more slowly, that's a failure. That's not the whole point of what we're trying to do. I agree with you, but I guess that's the lowest hanging fruit to achieve.
Yeah,
people knowing
that's
about
the
them.
easier part later,
Yeah,
but
yeah. But I think it does bring up all these different ideas. If you don't need the medication, then what was the original condition? I think it invites all these questions for people that have an open mind, completely. The last sort of few minutes here, let's talk a bit about now after stopping drugs. So you've mentioned, a lot of what examples you've given are kind of protracted withdrawal, people that have severe problems coming off and are sick for a long time. Obviously we're doing everything we can in Outro to avoid, because people are coming off very slowly, not in the way that the usual clinicians would see. So I want to focus just on the positive things for a moment. So
yeah.
maybe for you can also answer it about your clients. What improvements in your health have you seen since stopping the drugs? And I mean, after getting through withdrawal, what do you see between you on the drugs and you now off the drugs after withdrawal?
I actually wrote a list and I'm looking for it.
Oh, right.
So here,
Oh,
I
okay.
wrote a list. This is what I wrote. Okay. Many community members report that after they got through the most intense symptoms, they experience the following: post-traumatic growth, a new understanding of themselves, the world, their bodies, their nervous systems, a different perspective on their mental illness, their symptoms, or what they should do about them, more conscious of trauma, your patterns, behaviors, your boundaries, your goals, your ability to heal and change. People become more conscious of what goes in, on, or around their bodies, closer relationships, and ability to communicate their needs. They experience more compassion for self and others, more empathy, gratitude, meaning, less risk associated with long-term use of medication, a different relationship to the medical and mental health care systems, your ability to participate and integrate in therapy and alternative and complementary healing modalities, becoming pregnant, more present, more spiritual, more religious, more in touch with their own resilience and strength, a zest for life that they've never experienced before, less medication bottles, saved gas money, less copay, and a new path towards preventative medicine and towards true mental health. That's just some. I have a whole list.
I'll say 2 things. One, if there was a drug that could achieve all those things, it would be the biggest blockbuster.
I'd be selling it from the beach on Mexico.
Exactly. It would make Eli Lilly and AstraZeneca the biggest amount of money they've ever made in their entire lives. And 2, it makes me think actually of the most chilling cartoon that I've seen, which was, I guess I've been on a bit of a use the cliche, I've been on a bit of a journey myself. And when I was sort of first trying to work out what was going on with all these drugs, I sort of still had my training in the back of my mind and I was coming off the drugs. There's a therapist in the UK who drew a cartoon of people experience trauma, and there's two routes they go through. One is they go see a therapist or a coach, or they process it in some way. It takes them a while to get through it. It might take weeks, it might take months, and they come out of it and they grow from it. And the other limb was they go get medication. It freezes the emotions. They're numb. They never resolve the issue, and they get stuck in that holding pattern. When I saw that cartoon, I thought, shit, that is probably 15 years of my life in one cartoon.
Yep. Yep.
And so I think a bit what you're saying when you list all these different things is when you get broken out of that frozen position, what happens? Because you're describing emotional maturation, spiritual maturation, all these things that can't happen while you're emotionally numbed or a bit inhibited by drugs. And so I can't help but feel quite a pang of sadness hearing you say all those things. But obviously it's a very positive list.
Yep. That's usually what I see.
Yeah. I'll add a few slightly more tangible physical things. This is actually from Melanie Davis, who I work with, who's a very brilliant sort of benzo
From
Rest in London. She said there's 6 main things that people notice when they come off the drugs. One is gut problems clear up. A lot of people have things like IBS that they had on the drugs that go away. Number 2 is the emotional numbing goes away that people have on almost every drug. 3 is their sexuality comes back. Of course, it's inhibited by antidepressants. 4 is their concentration and memory is much improved. They think more clearly. I should have written down the list. I've run out at 4. If the other 2 come to me, but I see that all the time, those 4 in people.
Tons.
Again and again.
Even I see that in me. I'm 9.5 years off meds now. But even like this Burning Man season, I was like, wow, where did I get so creative? Like all of a sudden, like even when you think you're better, like still things like keep improving. It's like, wow, my brain, and you say everything you said, I agree with. Like I wasn't able to become who I really wanted to be. And I didn't know that, that the medication was stunting that. Like you see that in hindsight. But yeah, I think that's the reward at the end. And I think when people are in the heat of it or when they're at the beginning of the process, I always tell people zoom out a little bit. Like there's a bigger thing going on here. You can't see it from day to day, but like this is what everybody's kind of going through together. So these are the rewards at the end. This is why you're doing it. This is some of those reasons are what you identify as your why. Like I want to know what it's like to have my sexuality back. I'm willing to suffer a little bit for that,
Yeah.
So look at those endpoints because that can help give you strength during the process.
Yes. And actually, on the topic of perspective, because a lot of what you said is people look back. You said you have these very affecting sessions, people looking back on 20 years of their life. I think it's very hard to see it inside when you're inside it, if you're feeling very terrible inside the drugs, which I think is a bit about spellbinding. I do think people are not thinking about what's happening to their lives on the drugs because they're sort of stuck in the whirlpool and they see it afterwards. I think one route, and I think, you're very important here, is seeing lots of other people's stories helps you to make sense of your story. I think for example, a big moment for me was when I read on surviving antidepressants, that lots of people on antidepressants were diagnosed with chronic fatigue syndrome or narcolepsy because they were so tired. I remember reading someone saying, since I started this drug, antidepressant, I've had a nap every day for 2 hours. I thought, I've done exactly the same thing. When I heard that 6 times, I suddenly thought, hold on, I had a very I must have some illness called narcolepsy. I suddenly thought there's another explanation. I think that happens again and again when you read people's stories. There's lots of differences, of course. No one's the same. But I think you see common themes that emerge that help you make sense of your own life that you couldn't have done by just sort of sitting there going, what's going on here? So I do think that's and of course, your story on Medicating Normal is very, I think, a beacon to lots of people for that reason.
And that's why peer support is important because you hear other people going through the process and they say the same things that you do and they struggle with the similar things. So that makes you feel less crazy. Like, okay, this is probably part of withdrawal. Just hang in there. Other people are going through it and normalizes the situation and gives you a little strength to keep going. Yep.
Totally agree. I want to make sure you don't go exactly on the hour. So I'm going to ask you the last question or two from the chat. So I'm being very collaborative here. People are asking, what books do you recommend? It's a good question.
I have a whole reading list on if you go in my Instagram and you click on my bio where it says my Amazon, I think I have reading lists, but it's in my Amazon store. I have like 51 books in there, but I will tell you my top 3. Number 1 is Bob Whitaker's Anatomy of an Epidemic. Number 2, The Power of Now. Especially if you're in withdrawal, you have to become in a different relationship with your thoughts and the way that you're thinking and what you're taking seriously. That really helps with symptoms and thinking. And the third one would probably be Radical Acceptance by Tara Brach. just because this is so hard. It's like coming to the present moment and just being okay with being uncomfortable for a little while because there's an end goal and there's something happening that's bigger than you. I do think spirituality is a little important. Some of those spiritual concepts like really help us. Those would be my top 3. I also really like Anner's book, Crossing Zero. I didn't read it, but I keep hearing really good things about it. So about this process, I would probably recommend Anner's book, Crossing Zero.
It's on my list. It looks good as well. It's a good list. I'll add one more. Chemically Imbalanced by Joanna Moncrief is a very good summary of antidepressants that sort of summarize a lot of some of what we've talked about today. Is there any last thought you want to share? You've shared lots of thoughts.
I'll share a final thought. You can do it. I see a lot of people that are scared and they're terrified and they don't think that they have the strength to do it. And what I tell everybody that comes to my groups or individual, what we kind of hold on to, it's not the way that you think. Like your plan, your small mind has control the way that you think you do. Your body has a healing capability to recover from this. Okay, that's what it does. It's always finding homeostasis. That's the point of a taper, to give it tiny little stimuli so that it can adjust around that. And your human spirit is strong enough to do this. It's beyond your comprehension. You don't need to think that you're, people say to me all the time, like, you were military, you're different. No, it will take it. You have the strength in you. We're not different. Okay. So your human body and your human spirit is what gets you through this. Okay. That's beyond you thinking like, I need to figure this out and I need to plan it and I have to have the perfect taper plan and the perfect solution and the compounding pharmacy and all these little things that you try to control. Those are the 2 things that you put your hope and your faith in, and you become a little comfortable with uncertainty. You don't have to have all the answers today and know everything that's going to transpire. Live in the now, trust your body and trust the process, and you will get through this.
Nothing to add to that. Thank you very much, Angie, for talking to us. That was a wonderful conversation. Thank you for sharing that with everybody.
Thank you.